concepts and dump them and get them to understand that mental illness, severe mental illness, is a brain disease worthy of treatment. We also have to be translational. Benchtop research has to be transferred into effective clinical application. No more of those things that will just push out grants and people who said, take my word for it, it works. No, no. We have advanced enough in our field to understand empirical research ought to be there, and we can set up the designs to make sure it does. Unless we do that, and we just use word of mouth or take my word for it approaches, then anybody can say anything and it's acceptable. And then you ask yourselves, are we just as insane? And the third thing is it has to be transcendent. It has to move us forward from where we are over the horizon, over to new philosophies, not limited by things in the past. Not look at what has been and say that's what must be, but transcend those things. To say we have to have a system that's always moving forward. So our goals then became, one, turn a system of pessimism, closed doors, and bureaucratic hurdles into one that embraces innovation, evidence-based work, a spectrum of treatment options that fit the patient's needs, not the needs of the agency. Two, renovate those federal agencies to redesign their approaches to care and research, to be more effective, to integrate within and across disciplines, to coordinate care between agencies and departments and specialties. And three, we don't just ask for accountability, transparency, and innovation, and we don't just welcome it, we're going to demand it. And that's what has to happen to change us. So here's what the Helping Families in Mental Health Crisis Act seeks in rebuilding a broken system to help those who need it most. First of all, there's some things that we agreed upon out of the block when we talked with groups about this. We need to improve community mental health services by integrating mental health and primary care in community mental health centers. Two, you have to protect access to life-saving mental health medications for those on Medicaid and Medicare, the protected class of drugs, which you've already seen some movement on. Three, we have to reauthorize federal anti-suicide programs, which we've moved forward on. Four, we have to expand the use of health information technology from mental health providers so they can work with other physical medicine providers. Five, we have to expand research in the National Institute of Mental Health, especially in some of the brain paradigms, etc. And on these issues, there's significant common ground. We're moving forward on these. But we also need to fix this system where it's broken. And this is where we come up with those who are mired in the old ways, and they don't want to change it. But you know, this goes back to the issue, I'm a psychologist, I'm going to help you change. What do those stories, how many psychologists does it take to change a light bulb? You know, the answer is just one. That light bulb has to want to be changed. If you don't want to be changed, we'll vote you out. Key on this list is having a new office, the Assistant Secretary for Mental Health and Substance Abuse Disorders. We want this person to be a professional in the mental health field with experience in clinical and research. This person's goals will be threefold. One, they're going to reform the grants and programs within the agencies, particularly within HHS, but to evaluate their work, to coordinate efforts to get them to work together, to elevate those that work, and eliminate those that do not. Second on the list is have them do an annual report to Congress of the state of the state, what states are doing, what are their model programs, what are the best practices, how are they faring on so many measures that are out there, and even look at those things which it's hard to get data on. We know some things about suicide rate, suicide attempts, and substance abuse rates, and substance abuse deaths, but we also need more hard data on issues involved in incarcerations and arrests and jails and employment and reemployment among the mentally ill, and what states have done to make those things happen or not. We also push towards making sure that we implement and monitor the parity program. The Assistant Secretary will be assigned, because nobody is right now to do this. We passed a bill over 5 years ago on mental health parity. It took us 5 years to get the regulations. Do we have mental health parity yet? No. It has to happen. So those are the three key things that the Assistant Secretary will do, and he or she will have their hands full. But there's other reforms that must happen in order to help families and help individuals with mental illness. One, we have to fix this same-day billing rule. You know, two doctors really can see the patients in the same day. Children's Hospital in Pittsburgh did a study on this, and when they have the direct handoff in the pediatrician's office, where the pediatrician working with the family says, "We'd like you to see Dr. Smith right now," versus referring them to someone. When they have the immediate hand-up, it's over 99% follow-through versus just at 50.4% if they're given a name and told to call them. That's pretty significant. Number two, we have to fix the shortage of inpatient psychiatric hospital beds and end the federally sanctioned discrimination against those with mental illness on Medicaid by allowing them to access inpatient care when they need it. This allows us to also stop boarding people within the emergency department, another cruel practice. Now, to those who say, gee, if you build more psych hospitals, you're just going to put people in them, I say two things. First of all, we are not going to bring back the asylums of the 18th century. That's not going to happen. Those were places where people put people away because we had fear and we didn't know what to do with them. But second, when we built cancer treatment centers, we didn't cause cancer, we caused cures. And that's what we have to have the place for those who are in crisis. Instead of taking them to jail, instead of having them be tased, instead of having them beaten into jail, instead of having them fight back at a guard and have their sentence 4 times the length of someone else without mental illness, we want to get them correct and compassionate care. Number 3, we have to clarify the HIPAA laws so families can be part of frontline care. You know the story of anosognosia, and if you don't, then you don't know who Fullatori is. But the issue here is that since we introduced this bill, HHS has already clarified that yes, doctors can listen to family members. You really can. We still hear from families that say they won't listen to me. I'm trying to tell them about my brother or sister, my father or mother, my son or daughter. But we have that part clarified, but we need to put that in statute. But we still have to have a mechanism whereby someone can give an identified family member, and this is with a mental health professional, operate the highest level of ethics. They can provide that family member critically important information that is necessary for treatment. And in the absence of this information, in the absence of treatment, that person becomes gravely disabled. Information such as, who's the treating doctor, when's their next appointment, what medication are they on, and where are they supposed to be? Now those who can't even agree to that, I have trouble with that. Because it is the family member or some identified caregiver who's the one that's going to help that person be there, that person who may not even know who they are or where they're going. We have to get someone from the family and not rely on the government system that's failing. 4, to increase the mental health workforce so providers are there and willing to take on the most difficult and challenging cases. Increasing the number of psychiatrists, clinical psychologists, clinical social workers who are willing to dedicate their services towards severe mental illness. Also increasing volunteers at community health centers. Number 5, to promote the innovation in primary and secondary prevention. Now, a lot of what some federal agencies do is they just get involved in primary prevention. And that is the issue of, just give something to everybody and hope it all works. What I really want to do is shift it to secondary and tertiary. Well, if you know someone's at high risk, that's where we need to be spending the money. And if you know someone now has symptoms, that's where we need to be spending money in programs to help them get out of those traps. So for those children who have suffered trauma, we have programs like the traumatic stress programs, etc. We know there's programs that work, and that's where we should focus on money, not on sing-along programs, coloring books, making masks, and buying paintings of people sitting on the wall. We also, number 6, is to get substance abuse and mental health block grants to work together. They should not be separate. When you have a huge overlap between those with mental illness and substance abuse, how can you expect to treat them if you're treating them separately? We want states, and we're going to demand the states have programs that really integrate and coordinate these programs together. In my own state in Pennsylvania, they have some licensing rules that if someone is in a substance abuse center, they can't get mental health treatment because the providers created a moat of their licensing, which prevents them from treating people with a dual diagnosis. Well, we have to stop being self-serving here, folks, and start serving those in need. And number 7, we have to have fundamental reforms of SAMHSA. Now, SAMHSA just put out their request, their 2015 budget request. And I was reading it this morning, and you think that everything is fine in the world and there's absolutely no problem. page after page after page of saying everything's fine. It reminds me of that scene of Animal House where the people on the street were rioting, and who was that actor that was saying, remain calm? Kevin Bacon, remain calm, all is well. It is absurd. It is absolutely absurd. And an agency that does not realize the folly of some of its actions is an agency that doesn't deserve to continue to do the same thing. Organization and spending has to be reviewed. Since SAMHSA has created, if you look at the report card, the things, substance abuse has increased, death by substance abuse has increased, suicide, incarceration, unemployment have all increased. Show me the metric of success here, other than saying, take our word for it, our programs work. The record's a failure. What we have to make sure is that our black grants work together, that states are encouraged and rewarded for coming up with innovative programs. They report those, and the fact that the Assistant Secretary will gather this information together will help show other states what to do. Not coming out of just Washington, D.C., but what states can do. We also want to make sure that states have programs for those who are gravely disabled, not just those who commit a crime who are now in jail, but for those who are in that revolving door of going in and out of jail, of homeless shelters, living in subpar housing. There has to be some kind of a way that the states work with this. Assisted outpatient treatment is one of those ways. Let's look at other innovations, but states are going to have something there. The states are going to report on their programs. They're going to tell us what's working, and we're going to find out what's not working. And we want the grants revised. So these are innovation grants. We want ideas that are new, but ideas that work. Ideas that are based upon some sound research foundation, but then can be applied. When SAMHSA first came out, that's what it was supposed to be. That was supposed to be the applied wing that NIMH, and they had this, I don't know if it was an amicable separation or a bad divorce. But whatever it is, I used to do a lot of child custody work when I was a psychologist. That's what drove me to politics, I guess, because I thought it was a lot easier. But we're going to get people to begin to work together and be cooperative, and no longer use things that take my word for it, and that's not evidence. We are going to move forward in these things. We are going to keep good programs like the National Child Traumatic Stress Network and Minority Fellowship Program. We'll keep a lot of other things, but these are taxpayer dollars. And taxpayer dollars that should not be measured just in terms of the dollar value. But understand, if it's not helping the severely mentally ill out of treatment, with effective treatment, I'm not going to tolerate it. I'm not going to turn my back on those in jail, those living under a bridge, or those whose parents live in fear of, or those of family members who cry out every day for help. I will not turn my back. And despite those who are out there trying to tell all of us we're not going to do this, we have to be a strong voice that grows. We have to make sure that every judge, jury, police officer, physician, psychiatrist, psychologist, social worker, family member, advocate, people who work on housing, everything. All of us work together and say, despite some nuances where we may say that perhaps we go a little bit different way, we've got to pull together. This is an important moment in history, an important moment in history. Not just perhaps for the last 50 years, but perhaps in the history of our nation, where we have moved from the days, Dorothea Dix, Benjamin Rush, looking to see what we do for those with mental illness, to the days now when we understand this new paradigm. Only last summer, when 108 genetic markers now for schizophrenia, now genetic markers for bipolar, where we see some other studies on the prodromal developments of the brain, of what happens with the hippocampus, the limbic system, the frontal lobe, and new functional MRI imaging. It is a phenomenal growth in what we know. The federal government cannot hold that back. I would say that for those who want to hold us back, if they just keep the old ways, they may not work, but at least I have a funding stream. What we have to be motivated here is something that is much stronger. And it may not be a concept that we can measure much, but is the concept of love for our family members who are out there who have suffered enough. I would match that up against anybody else. And that is what has to keep us going through this. So, as we move forward, as we reintroduce this bill in a few weeks after we do some other polishing and tinkering in this, help us get members of Congress on board. We had 150 co-sponsors before. We want to get more. We're already talking to several senators who have expressed an interest in this. Roy Blunt, Chris Murphy, Lisa Murkowski, Bill Cassidy, of course, will take the lead on this, and others. There's other senators as well. Talk it up. We have to work on bicameral and bipartisan on this. I may not be prone to making campaign promises, because I always say you have to be careful with that. But I promise you this in my life. I will not rest. I will not yield. I will not give up. I will not turn my back until we fix this problem of helping those with severe mental illness in America. Thank you very much for all you do, and thank you for this recognition.